Welcome back to Today's Health. Today we're talking about common causes of shoulder pain with Dr. Timothy Lukas. Dr. Lukas, now who is most likely to develop a shoulder disorder?
So it runs the gamut. So in young people, it tends to be athletes that have an acute injury, a football player that dislocates their shoulder on the field or sprains their AC joint. As you get older, it's patients that are doing a lot of overhead activity, particularly laborers or anybody that has a job that involves a lot of raising your arm over your head repetitively, and particularly when you lift heavy weights overhead. They develop, let me see if we can pull that picture up. They develop that impingement we talked about, where that rotator cuff impinges on the anterior surface, or that hook of bone in the front. As we get older and people start to wear out the cartilage between the ball and the socket, older patients tend to develop arthritis. They can have falls too. Older patients that have falls tend to be more prone to tearing the rotator cuff because the tendons weaken as we get older. I'll get the middle-aged patient that comes in with a frozen shoulder, stiffness that develops out of nowhere, intense pain, and they don't know why. And that's a relatively easy one for me to diagnose. But it's very common in middle-aged females, believe it or not.
So you mentioned arthritis as being one of the issues that affect older adults. Are there other things that affect older adults?
Really, arthritis is probably the big one. Over time, we wear that cushion between the ball and the socket, particularly people that have been active their entire lives. And in addition, that impingement or that friction syndrome, as you get older, when you get in your 60s and 70s, that lifetime of use wears through that tendon, and you can develop attritional tears. So the pain doesn't all of a sudden come on, but it builds up over years.
Doctor, are there possible causes of shoulder pain that are not directly related to the shoulder?
Sure, and that's the key when the patient comes in and we take a thorough history. Where's the pain coming from? Do you feel it radiating up into your neck and down your arm? People that have pinched nerves in their neck can develop numbness that radiates from their neck down into their hand, weakness, tingling, burning, those type of things. We also want to make sure there's not some type of lung or heart issue. Patients that are active and exerting themselves, if they start to develop left shoulder pain that radiates down their arm, we start worrying about cardiac issues. Sometimes problems with the lung, cancer in the lung, can start out and present with shoulder pain too. We want to make sure we don't miss anything important like that.
Now, if you're having some shoulder discomfort at home, is there anything that you can do to try and manage it at home before seeking medical treatment?
Again, I like to go back to the common sense approach. Rest it for a couple of days, see if the symptoms start to get better. Some over-the-counter anti-inflammatories like ibuprofen. I like to go 600 milligrams a couple times a day, consistently for 3 or 4 days to see if that settles things down. Initially, if there's not an injury, icing it down is okay, or heat if it feels better. But if there's an acute injury, icing it's always better.
Now, are there any risks related to ignoring pain in your shoulder?
Yeah, if a patient if you've had a fall and you develop weakness and you've lost motion and you just kind of sit on that for a couple of months, if you actually tear this rotator cuff off of the bone and you let it go for an extended period of time, that muscle keeps pulling that tendon farther away from the bone and it starts to scar in. So it makes repairing that actually difficult and sometimes impossible if you wait too long.
So letting it go could actually make it impossible to fix in some situations.
That's true, and I've seen that, and it's unfortunate, but that's the way nature works sometimes.
So at what point really, as a general rule, should somebody seek medical treatment for shoulder pain?
So if you're having pain that limits your normal function, your normal daily activities, and it's keeping you from sleeping, then it's time to get it checked out. If it lasts more than a week, I would get it checked out so at least you know what you're dealing with and you'll come up with a plan on how to make things better.
Doctor, this is great information. It's time for another break. We'll continue in a moment.